Hey guys, it's Dr. Adam Nally coming to you again. I have had a lot of questions from people regarding how to use their ketone monitor. Now I have one of the Keto Mojo monitors here, and I'm going to show you how you use this. A lot of people have asked me, well, what exactly am I looking for when I check my ketones? And so one of the things that's important to understand when you're using your ketone monitor is number one, it's different than blood glucose, and we're using a ketone monitor to check for for implied insulin levels. Remember, when our insulin goes up, we're going to gain weight. When our insulin goes up, we're going to see inflammation. We're going to see increased fatigue. We're going to see hunger. We're going to see even hypoglycemia or low-level blood sugars. The blood sugar will drop to a low level. So it's important to understand that using your ketone monitor is going to give you some important data that way. So I like the Keto Mojo. It's cheaper. It's less expensive. It comes with a test strip. Some people have asked me how to use them. There are these little test strips, and so I'm going to check my ketones right now. This is the little test strip, and I'll show you what it is here. You just take the test strip and you plug the test strip into your monitor, the top of your monitor here, which I'm going to do right now. It has to charge itself up for a second and reset itself. I'm going to pull out my little pin prick here. We're going to see if it's, check myself, prick my finger with that. It's going to take a second or two sometimes you may need to squeeze the finger just a little bit. And then basically what you do is you just take your monitor and you bring it up next to your finger, and it has, through capillary action, the opportunity to, and I've got a little tissue I'm going to put my finger on there. Through capillary action, it draws that blood up, and within about 10 seconds, it's going to give you a result. Now, my blood glucose ketones right now, as you can see here, are 1.1. You can see that's pretty good. Now, what number are you looking for? As you can see, mine is at 1.1. I'm going to toss that, throw that away, so I'm not bleeding all over everything and getting blood everywhere. But we check so the first question is what number are we looking for? We're looking to get our blood sugar somewhere between 0.5 and roughly about 1.5, 1.5. We know that great fat loss occurs in somewhere in that range. The most efficient fat loss seems to occur between 0.9 and 1.5. And so that seems to be really effective in that region. It doesn't matter if your ketones are going up much higher. Some people's body holds their ketones higher. Now, there is some data that implies that when your ketones are higher than 1.5, that you may actually be eating too much fat. And that your body's processing that fat a lot faster, and that may be inhibiting or slowing your metabolism slightly. There's still some question in regards to that, and there's only a small clinical study that points that out. But but the question arises what's the most ideal fat range? And a lot of clinicians feel that it's somewhere between 0.9 and 1.5 is a goal. I'm at 1.1, which is right where I should be. Now, all I've had is a couple ketone drinks and 4 eggs, and it's now about almost noon. And so that's been I had actually 4 eggs about an hour ago. And so I'm in a good state of ketosis. Now, what does that mean? What that means is when your ketones are in that range, it means that your insulin is low enough for your body to use ketones in the predominant factor. It also means that your glucose is low enough that your body's not having to produce insulin to lower that glucose. If the glucose rises, your body produces more insulin, and then insulin pushes the ketone levels down. So we're looking at insulin kind of through the back door, if that makes sense. That's what we're doing. So the next question people ask me is, well, how often should I check my ketones? Now, these test strips are not cheap, and so you want to be frugal with them if you need to. But what I find is that I would want to check my ketones usually after the meal that I'm in question. Is that meal throwing me out of ketosis? Now, I know pretty often that I'm in ketosis because I've checked myself a lot. But what I will do sometimes is I'll check myself a couple hours after breakfast and see what that breakfast did. I'll check myself a couple hours after dinner and see what that dinner did. You're going to see the lowest level of ketones first thing in the morning, because the process of waking you up releases, there's a whole cascade of hormones that are released. Those hormones, including cortisol, actually will it'll stimulate a little bit of gluconeogenesis, production of glucose from the liver, and you'll actually see a rise in insulin, and ketone levels will fall. So right when you first wake up, you're going to see a low ketone level. That's okay. Don't worry about it. Even if it's down to 0.3 or 0.2, I'm not worried. Second issue, you're going to see a lower ketone level right after exercise, usually up to an hour after exercise, because exercise, in the process of exercising, especially if it's somewhat of an aerobic exercise, your body wants to pull glucose in, so it's going to make some glucose from the liver, and you're going to see a slight dampening down or a lowering of the glucose at that point in time. 2-3 hours after exercise, you're going to see those ketones return back to normal again. That's normal. That's okay. So check your ketones maybe once a day, and maybe once or twice a week if you want to do that. But what it's going to do for you is give you an idea of where do you want to be in that ketone range. What do the ketones do for you, and where's your fat burning? Now, a lot of people say, well, doctor, I'm in ketosis. And for about 5 years before we started checking ketones, I thought I was in ketosis a lot of time, and I wasn't. And that was driven by some of the food that was in my diet, some of the lack of sleep that I had, stress responses, types of foods that I was eating, sweeteners that I was eating, various things like that can actually kick you out of ketosis. And one of the ways that I can tell, and one of the ways I've learned about which sweeteners are effective and which ones aren't is essentially by using a ketone meter to determine how that works. So hopefully that's a little 5-minute tidbit on how to use your ketone meter and why it's important to check ketones. We'll place this up on the Facebook site. I'm also going to put this into the modular section, as this will be a video module number 10, and so it'll give you some information about why checking ketones. This will be there for you. If you're watching this, you probably already know that because you watched it. So hopefully that helps. I'll pop this onto the Facebook page, the Facebook Keto Clan page, and leave it there for a while so that it has some access, and you can ask some questions down below about ketones, and we can update it from there. But for now, keep the fat high, keep the carbs low, and pass the bacon. You guys have a great day. Bye-bye.